Good morning, everyone. 20 new cases overnight, 9 linked, 11 still under investigation. 7 were in quarantine during their entire infectious period. At least 7 spent some of their infectious period in the community, and the balance, the remaining 6 cases, investigations continue. We've had a slight increase in the number of people in hospital, up to 10. And we have 2 people now in intensive care, 1 requiring ventilation. Yesterday, nearly 3,400 tests were conducted. This is a good level of surveillance across the community. So thank you to those who came forward for testing. A reminder that if you have any symptoms, please come forward for testing immediately. You must isolate whilst awaiting your test result. So don't go to the testing centre via a supermarket or a drive-through. This is one of the areas of risk that we have experienced. In compliance, generally good feedback from ACT Police, Access Canberra and WorkSafe ACT. 662 traffic stops yesterday and only 3 directions to leave the ACT. Business compliance continues to be very good, with the 2 consistent themes that I've been raising every day now. Incorrect or not wearing of masks in some business settings, and workers not checking in to their place of work. So just another reminder, the whole point of masks is to protect you, your work colleagues, and any customers that you have any interaction with. So it's important to wear a mask and to wear it properly, please. On the vaccination front, another great day, a record for vaccinations in the Territory. 4,737 receiving either their first or second dose. I can report that 80% of our over 70s population are now fully vaccinated. I believe we are the first jurisdiction in Australia to achieve that milestone for our over 70s population. Based on the first doses of that age cohort, we expect to be able to reach over 95% fully vaccinated in the coming months. More than 90% of our over 50s population have now had a first dose of the vaccine. And we also expect this cohort to reach more than 95% fully vaccinated in the coming months. The first dose rates for 40 to 49-year-olds is currently at 85%. And again, I think this is an encouraging sign that this age cohort will track towards 95% fully vaccinated in the coming months. Demand for vaccines in the ACT remains very strong. There are 75,000 people now booked for their first vaccine dose at ACT government clinics, the vast majority of these being Pfizer bookings. We have close to 250,000 people who have now received at least 1 dose of a vaccine. We can expect to have at least 325,000 of our city's residents vaccinated, and this could grow even larger with additional vaccinations being provided through our primary healthcare network. The key thing to look at here will be the take-up of the Moderna vaccine through pharmacists when that arrives later this month. There are, of course, a lot of people still to vaccinate, and this is going to take some time. For most unvaccinated Canberrans during this outbreak of the virus, the very clear advice is that the best vaccine is the one that is available to you today. That having the protection of at least a first dose, and then even more importantly, being fully vaccinated as soon as possible, is the best thing that you can do to protect yourself and your family. If you can get your first dose earlier with the AstraZeneca vaccine and become fully vaccinated, you really should consider this option. Turning now to the construction industry. This Friday will see the recommencement of the balance of the ACT construction industry. As with the larger construction sector, there will be stringent COVID-safe requirements in place in order to reduce the risk to constructors and to households. There is to be no interaction between workers and residents within a construction site, a renovation site, any premise. The ACT COVID safe construction guidelines reflect the arrangements that are in place in New South Wales and Victoria. There will be a further industry briefing this afternoon ahead of the restart of work across the balance of the construction sector on Friday. Now, there's a lot of interest in what the future looks like. In short, we are going to be facing a challenging few months. Until we exceed those vaccination targets that provide the community with the protection we need, we can only gradually ease restrictions. Our primary goal remains the health and protecting the health of our community. We are very acutely aware of the need to also consider the economic impacts and the mental health and well-being impacts that come from ongoing public health restrictions. But to be as blunt as I can be, if the virus gets out of control in Canberra, we will experience even greater health and economic challenges than we are right now. We can't let that happen, and we won't. But it will be a balancing act over the coming weeks and months. The best thing that the community can do, that any individual in Canberra can do, is to get vaccinated as soon as you possibly can. If you have any symptoms or you've been to any of the exposure sites within the timeframes identified, you must come forward for testing and you must isolate whilst we get your test result to you. And you must follow the public health advice. The only way that we can gradually ease our restrictions in the coming weeks and months is if more people get vaccinated, people who have symptoms or who've been to exposure sites come forward for testing and isolate, and we continue to follow the public health directions. If we all do that, then we can gently step our way out of the situation we are in now. If it goes the other way and we see our case numbers explode, we will not be able to further ease restrictions in the coming weeks. So our preferred pathway, in partnership with the community, is to see vaccination numbers continue to set new records day on day, that those who do unfortunately contract the virus through no fault of their own come forward for testing, isolate and quarantine, and that everyone follows the public health directions to protect each other. Now, I know there's some people who really just don't seem to care about the rest of the community. But for those people, care about yourself and those closest to you. Because most of the transmission is occurring when someone gets infected and brings the virus back into their own home and infects the people closest to them. That's the saddest part of what we've been seeing over the last 4 weeks. So in conclusion, for those who've joined late, a quick recap. 20 new cases, 9 linked, 7 in quarantine during their entire infectious period, at least 7 infectious in the community for part of the time, and 6 still under investigation. 10 people now in hospital and 2 in the care of our wonderful team in the intensive care unit at Canberra Hospital. And as always, our thoughts are with the family and friends of those individuals. It's tough, and it would be incredibly hard if one of your loved ones was in intensive care. So we send our love to those families. I'll now hand to the Deputy Chief Health Officer, Dr. Johnston, for a further update on today's cases and epidemiology. Minister Rachel Stephen-Smith will then provide an update, and then all 3 of us will be available for questions. Thank you.
I'm Dr. Vanessa Johnston, the Deputy Chief Health Officer of the ACT. So, as the Chief Minister has just said, since our update yesterday, the ACT has recorded 20 new COVID-19 cases. Our total cases for this outbreak now stands at 424. A total of 193 of our cases for this outbreak have now recovered, which is great news. And so this leaves 231 active cases. Of the new cases today, I can confirm that out of the 20, 9 can be linked to known cases or ongoing clusters, and 11 remain under early investigation. Out of those 9, we know that 8 are household contacts. Out of the total of 20, 7 were in quarantine during their entire infectious period. Of the remaining 13, 7 spent some time in the community for part of their infectious period, and 6 remain again under investigation. We have 10 people today in our hospitals. 2 of these are in an ICU and 1 requires ventilation. 6 of the 10 are unvaccinated, 3 have received 1 dose, and 1 is unknown at this stage. The total number of people hospitalised for this entire outbreak now stands at 34 across the Canberra Hospital and Calvary Public Hospital in Bruce. Of these 34, 6 have required treatment in ICU and 2 have required ventilation. We now just have over 1,500 self-identified close contacts and over 350 active exposure locations. In terms of the analysis of the broader outbreak, there continues to be very little change in the age range breakdown. So the majority, 56% of our cases are aged between 18 to 44, followed by 28% in people aged 0 to 17 years. So this is just down 1% in this age group from yesterday. So I'd like to provide you now an update on our public sites of transmission. And I want to explain today that these sites are highlighted as we know and have been able to establish that transmission has occurred here, and therefore we want everyone that's potentially exposed and doesn't already know to become aware of it and get tested if necessary and to follow the public health directions. As we've discussed previously, these sites and the total number of cases associated will continue to change as the team undertakes their analysis and their interviewing process, which can take several attempts. Cases may have links to more than one exposure site, and as these links become clearer, cases may be reclassified to certain clusters. So that's why you sometimes see that the total number changes without the addition of new cases. Once a period of 14 days has passed, so that's one incubation period, without any confirmed transmission from a site, these sites are no longer considered active and are going to be removed from the list. So following an assessment, our team have now determined that a number of public sites of transmission can now be removed. So I'm pleased to say today that we only have 6 active public sites of transmission in the ACT. So these total figures also include any transmission both confirmed at the site but as well as onward transmission, such as to household contacts. So our sites are Bright Bees Early Learning Centre with 38 cases, 1's reclassified today. Murchie Indian Restaurant with 11 cases, that's 3 new cases. Bid Food Canberra 8, Ainsley Village 6, Busy Bees Childcare Centre 6, Priceline Pharmacy Woden 5, and KFC Dixon 4. So the 3 new cases that are linked to the Murchie Indian Restaurant are household contacts, so not entirely unexpected. I'd like to take this opportunity to remind all of our Year 12 students that a dedicated number of priority bookings have been set aside for you. This is available until the end of next week only. So please make sure that if you haven't booked your appointment, that you do so. If you're an eligible Year 12 student, do it quickly. And if there are parents out there of Year 12 students that know their child hasn't booked yet, please get that done. So to make an appointment, please phone the vaccination booking line on 02 5124 7700 between 7 a.m. to 7 p.m. My shout out today goes to the Health Protection Service of ACT Health. This team plays a critical role in our COVID-19 response, as well as keeping up really essential day-to-day business across Canberra. They work in partnership with Access Canberra and ACT Policing to ensure that business understands and complies by the public health directions. And other areas of HPS work with pharmacies regarding controlled medicines and environmental monitoring. And that's just to name a few of the critical work that they do. Thank you for continuing to keep up this important work, especially as so many of you have been called into the COVID-19 response unit. We know it's challenging and we're thinking of you, and thank you again.
Good afternoon. The other day, I took the opportunity to thank the residents of Condamine Court for staying the course and quarantining for 2 weeks, recognising how difficult this was. The vast majority of residents at Condamine Court did the right thing, stayed inside, and helped to keep Canberra safe. The same is true at Ainsley Village. The vast majority of residents are doing the right thing and understand how important this is to protect themselves, the people they live with, and the wider community. While we've heard some concerns from residents, we've also received positive feedback about the support people are receiving from our multi-agency response and our community partners, all working together in a complex operation to support tenants. On Monday, more than 100 people were tested on site at Ainsley Village. Of those, 4 returned positive results yesterday, which are included in today's figures. We are providing ongoing support to assist those who have tested positive to effectively isolate. This includes offering them dedicated accommodation to ensure that they can safely isolate away from the village. And there are currently no active cases on site that we are aware of. All other residents of Ainsley Village have been asked to stay at home for their own safety and well-being and to protect the wider community. These are the same requirements as for close contacts across the ACT. I want to emphasise today that it would be absolutely wrong and unfair to cast aspersions about those Ainsley Village residents who have now tested positive for COVID-19, or to suggest that these individuals are somehow responsible for the ongoing spread of coronavirus in our community. As the Chief Minister and Chief Health Officer have previously talked about, we've seen 5 separate incursions of COVID-19 into the ACT since this outbreak began. Every day, we are still seeing cases who were infectious in the community for part of their infectious period. These people come from all walks of life. For most of these individuals, this is simply a reflection of the fact that the virus is out in our community and the Delta variant is highly transmissible. People can generate a viral load and become infectious before they even know they have been exposed. The virus does not discriminate, and neither should we. Having said that, we are obviously aware that some individuals find quarantine particularly challenging. Dr. Coleman spoke the other day about a range of circumstances that can make quarantine difficult. We've heard the concerns from some Ainsley Village residents about other residents' movement within Ainsley Village and across other sites. The team continues to work with all residents to understand their needs and how they can be supported to quarantine safely. Government and community partners are also working to understand and mitigate the risk of any spread outside Ainsley Village. In addition to regular testing at Ainsley Village, a surveillance testing program has been established to enable ACT Health to identify any potential spread as quickly as possible. Testing is being offered in a range of accessible locations to people who live in social housing in the inner north and to clients of homelessness services. The ACT government team is working with trusted non-government service providers to encourage people to be tested so that we can pick up any new cases quickly and manage their potential for further transmission. Yesterday, testing occurred at 2 sites and all those results have come back negative. I want to again thank staff from across the ACT Health Directorate, Canberra Health Services, Housing ACT, Community Services Directorate, Emergency Services Agency and ACT Policing, who have been working together throughout this response. I particularly again want to thank our community sector partners who continue to support this public health response. By my calculation, there are probably a dozen organisations across the health, housing, homelessness and emergency relief sectors that are now directly supporting this response, and each is playing a critical role. The ACT Government has also collaborated with the Capital Health Network and the Commonwealth Government to support our community partners such as Interchange Health Co-op, Directions Health Services and Companion House to provide vaccinations for our diverse communities. This includes providing outreach and mobile services across a number of social housing and other sites in Canberra. The ACT Government has so far provided around 500 vaccine doses to community partners as part of our Equity to Access program. This is in addition to the doses provided by the Commonwealth to these primary healthcare providers. The program is focused on communities who may face multiple barriers to accessing mainstream health services, and we will continue to work with these partners to ensure that all Canberrans have the opportunity to get vaccinated. Ensuring these communities have access to vaccination in a way that works for them is critical to the broader COVID-19 response for the whole community. Before I hand back to the Chief Minister, a reminder about some changes to our testing sites. Western Creek Walk-in Centre Testing Clinic and the drive-through clinic at Brindabella Business Park are no longer operating as testing sites. Western Creek will return to providing walk-in centre services, treating minor injuries and illnesses, and the staff from Brindabella have been redeployed to boost capacity at other parts of the health system. The COVID-19 Surge Centre in Garran is reopening as a testing site from 2 p.m. today for the general public, as well as providing access and sensory testing for people with disabilities. It will then be open for 7 days a week from 7:30 a.m. to 9 p.m. For details on the opening hours of our other testing facilities, please visit the COVID-19 website or keep an eye on our social media. Finally, it is great to see our testing numbers increase again, with almost 3,400 tests conducted yesterday. So let's keep this up, Canberra. Testing and surveillance is incredibly important as part of our response. So thank you, and remember, with the mildest of symptoms, please get tested. Thank you.
Thank you very much, Rachel. Happy to take questions. So I'm starting with you, Harry.
Chief Minister, you spoke about vaccination being the preferred pathway forward. Doesn't sound like you're overly optimistic about the lockdown as we know it ending on the 17th of September as scheduled.
Well, look, we are still getting case numbers in the teens and sometimes into the 20s with an occasional spike. The combination of the increased vaccination rate, the test, trace, isolate and quarantine regime that we have in place, plus the public health measures containing the viral spread, but it's not going down to zero at the moment. We're still seeing cases infectious in the community. We have always said, and I from this podium have said probably 30 times now, so I'll say it for the 31st, any movement is going to be gradual. I'd refer people in terms of what the different steps are through the vaccination thresholds to the underlying assumptions of the Doherty Institute modelling, which talk about high, medium, low and baseline public health social measures. Now, we've been at the high end of the spectrum and we've had one easing. So we're still sitting in the high end of the spectrum but not at the highest end. We will step through medium and low before we get to baseline. And baseline, which I think again has been misinterpreted in the media, is not that there are no public health restrictions, but there would be some. But at the moment, we are sitting at high, and the next phase of our journey is to transition from high to medium. And medium, which was based on the New South Wales, in terms of the Doherty Institute modelling, was based on where New South Wales were in July, which still includes things like stay-at-home orders.
So have you given up on a donut day, 0 cases anytime soon?
I haven't given up. We're not going to give up on the suite of public health measures that bend the curve, but it's clear that we're not going to have 0 days tomorrow or the next day, and so we're going to have to continue to vaccinate. We're going to have to continue our effective test, trace, isolate and quarantine regime, although as you know, the lived experience of the last 4 weeks shows, it's very effective, but it's not 100% perfect, and so that still means we need to rely also on the third part of our response, which is the public health social measures. But we have been easing. I mean, from where we are today and where we'll be on Friday to where we were a month ago, there has been a gradual easing of restrictions.
Chief Minister, we have 10% of our population roughly under the age of 12 who don't have a vaccine at the moment. Given there's discussions about including these people in the population statistics to open up or reduce restrictions across Australia, where are conversations, first of all, lying with that, with your counterpart Anastasia Palaszczuk, and can we include them in the statistics if we can't get to that threshold without a vaccine for them?
Okay, so I'm not aware of any discussion of including people who can't be vaccinated in the denominator, being the determinant figure around what percentage of a population. So until we have approved vaccines for 0 to 11-year-olds, you would not include them in the denominator, as in the proportion of the population that you would say are eligible for vaccination, because they're not currently eligible for vaccination. So the debate, as you've described it, is in fact whether we're talking about 16 plus or 12 plus in the denominator for reaching certain percentage thresholds. I have said, and I'm not the only First Minister to say this, that given we can vaccinate 12 plus, and we have now 2 TGA-approved vaccines to do so, that we should vaccinate 12 plus, and we should consider them in our overall eligible vaccinated population thresholds. Now, the difference in time based on the velocity of our vaccination program could be a matter of a week or two, Dominic, between the difference of hitting 70 and 80% of 12 plus versus 70 and 80% of 16 plus. They are Canberrans. They are Australians. They are eligible with approved vaccines. We should aspire to vaccinate them. That will help in the overall community health outcomes, and it will also enable school to return in a safer way. So yes, it's important that we focus on that cohort.
A recent FOI release appears to show that the government was slow, or the federal government was slow to strike a deal with Pfizer for a COVID vaccine supply. How frustrating is that for you as a territory leader?
Well, look, the vaccine program has been fully utilised within the ACT. Every available dose of Pfizer is being utilised. And the only thing holding this community back from reaching and exceeding those vaccination thresholds has been the lack of Pfizer supplies. We've also had a pretty strong take-up of AstraZeneca as well. So if more vaccines had been available earlier in the process, we would be closer now to those levels of vaccination that provide the whole community with a much greater level of protection against the disease. And so, yes, it's frustrating. It's been frustrating that for legitimate reasons, vaccine supply was directed into New South Wales. Now, I don't contest the reasons for it, but is it frustrating that it's holding up the rest of the country and delaying them getting to 70% and 80%? Of course it is. But now we have more vaccines arriving over the coming weeks and months, and so we turn our mind to dealing with how we can best get that vaccination rate even higher in the ACT and those available vaccines to as many people as possible, as quickly as possible.
Should the federal government have done more?
Oh, well, I think it's hard not to reach that conclusion, is it, really? That has been one of the challenges, not just here but around Australia. But it is what it is now. So all we can do is deal with the available vaccine supply we have and work with our communities to get as many people vaccinated as quickly as possible. The historians will look at this period and probably draw the conclusion that more should have been done earlier in terms of vaccine supply, but we'll deal with the situation we've got now.
As of yesterday afternoon, 5,770 Canberra businesses applied for the business support grants, and an additional 1,852 had applications in progress. Is anything being done to speed up the payments to those businesses?
Yes, so I can report that $6.9 million has already been paid to more than 400 businesses. We are seeing a proportion of applications that don't have valid or active Australian business numbers. We're seeing applicants who are not registered for the GST, and we're seeing applicants who a quick ASIC search shows that their business numbers or their businesses have either been cancelled, are in external administration or are in liquidation. So our compliance checks are demonstrating that there is a degree of activity here that is perhaps not in the spirit of the business support program that we're endeavouring to undertake. We have more than 100 people working 7 days a week assessing applications, and we've already paid out nearly $7 million. Some payments made within 7 days of the scheme opening. Comparative with New South Wales, that's 2 to 3 weeks ahead of their rollout of their equivalent scheme. So we continue to assess applications each and every day, and we're making regular payments as each application is approved, and then the money is then transited to the bank account, the checked bank account of that particular business. I have been advised that there's been at least 3 or 4 businesses that have not provided the correct bank account, and the money's bounced back. So we are checking that as well. Our bank is confirming, and we're making sure that the money is going into the right bank account. So I do want to send a clear message to anyone who thinks they can try and scam this system. You can't. It is being checked.
I suppose businesses that have done the right thing and are still waiting, what's the message to them?
We're processing your applications as quickly as possible. The best thing that you can do to help is to read the guidelines in the scheme to provide the information. The quicker the information is provided, the easier it is for the team of more than 100 assessors to assess the application and make the payment to you. Hundreds of businesses have already been paid, many within a week. So a good, complete application with the information that has been requested means you'll get paid more quickly.
Are you able to put like a number or sort of a figure on how many businesses have, either applied with incorrect information or, as you said, with ABNs that are out of date? Is there any figures there?
We are talking about a proportion. We've got 1,848 applications that need further information out of the 6,000 that have been received. So that's nearly 1 in 3.
You mentioned, I guess, your attitudes or thoughts on vaccine passports, particularly in other jurisdictions, the difference with technology. Can you, I guess, talk about any work that's underway to perhaps adapt or bring in new technology in the ACT so that we can get something online with that, or what work's underway?
So our app development team who developed the Check in Canberra app, looking at the technical options associated with how someone could download their Medicare or MyGov approved vaccination certificate to have it be part of the app. But our app is not an identity verification app. So part of the issue here will be it's not necessarily going to make it any easier or quicker. You may as well just use your Medicare. You can add it into your Apple Wallet and you can just display it. Of course, across the nation, many people have already demonstrated that inside 15 minutes you can fraudulently produce a vaccination certificate. So part of the issue here is that the Commonwealth are going to have to do a lot more work to ensure that those things are secure. But we will not be in a position to develop a Service New South Wales style identity verification app in the next period. So this really will not be a path that the ACT will go down in that regard. There is a live question as to whether we can allow people to have their vaccination status from the Commonwealth included in their check-in CBR app, but it can't be identity verified. And so you're going to see a lot of fraud here, I think, regardless. It'll be harder to do it, to travel to another country, but there will be a lot of internal fraud within Australia. So I just sound this word of caution about this whole process to suggest that vaccine passports are going to be this magic ticket to freedom, that they are very difficult to verify, easily corrupted, and don't necessarily deliver any of the great either public health or vaccination encouragement benefits that some might be claiming. That's all untested claims that are being made. The evidence I have before me in relation to vaccination take-up in the ACT is that people don't need a vaccination certificate to want to get vaccinated in our jurisdiction, but they might in others. I readily accept that. But here in Canberra, it's looking a lot like a solution looking for a problem in terms of driving vaccination rates.
Sorry, on residential construction, are you able to provide some numbers about how many sites are expected to open, how many people are expected to go back to work on Friday?
Well, I think the estimates on the workforce are about 13,000, meaning that there were about 7,000 in the larger end, and there's about 20,000 jobs in construction. So that's sort of the rough ballpark estimates. In terms of construction sites, no, I don't have an exact number there, but they'll be in the thousands.
Questions for Dr. Johnson?
Yes.
Doctor, can you confirm there was a case at the RGKC DFAT building, and if so, why it hasn't been listed on the exposure sites list?
Yeah, I can confirm there's a case. So it hasn't been listed on the public exposure site list because there is no risk to the general public. So in the event that there isn't a risk to the general public, and we can identify staff who may be close or casual contacts, as we can in this case, then we directly message those impacted.
On messaging, close contacts, we're still hearing in the community some confusion about how long people should expect to wait before they're notified by text message or by call if they've been to an exposure location. Is the message still to those people to not rely on one of those notifications coming through?
The message is that there's a number of ways that you can find out that you may have been to a close or casual exposure site. Obviously, twice a day we update our website. So, a fervent recommendation is to keep up to date with that website. There is also, obviously, the Check in Canberra data, which we use, not particularly effective if you haven't checked in, but also we work around specific windows. So there is an event that we may miss you, so you got to use every measure you can to keep across it. And obviously we directly message staff when we have identified staff lists that are provided by companies as well. So there's a range of ways that you may be notified, but it may take you to look at the website and fill out a declaration form, and everyone should be looking at the website.
Are you able to break down how many people in the current outbreak have received 2 doses of vaccine and 1 dose of vaccine?
Look, I have numbers today, but I'm actually not confident that they're validated. So the team is doing some more work on that today, and we will endeavour to get that to you tomorrow.
Can I just clarify something? So it was 34 people have been hospitalised throughout this entire outbreak, not 23, as was said yesterday?
Yeah, so today the numbers I have is 34, so that's about 8%, which is what we would expect.
And you're confident that the hospital can handle that caseload?
Yeah, look, there's been a lot of planning work underway in the hospital sector, and certainly they're doing really, really very well at handling the cases they have there now, and I know that there's more capacity coming online as well, so very happy with that.
And in terms of ICU beds in total in Canberra, how many of them are occupied, and those including non-COVID cases as well?
Yeah, I can't give you that number. That'd be a question for Canberra Health Services.
Given the plateau of numbers over the last week or so, we're seeing around the teens and around half infectious in the community, maybe a bit less. What's it looking like in terms of the next week in easing restrictions? Are we heading towards some restrictions easing, or is the plateau not good enough? Do you want to see them drop more before making any advice or recommendations?
Yeah, so I think you're right in terms of the rolling sort of 5-day average of new cases. That is plateauing and going in the right direction. That's going down, notwithstanding the few kind of peaks that we have. We also have the troughs, so the rolling average is what we looked at. In terms of the proportion in quarantine for the whole infectious period, that's baselining, maybe going up a little bit, so that we're not particularly happy with that. So that still remains a concern for us, and as well as the fact that we still have many unlinked cases. So I'm looking at my stats today, and I believe we have 40 for this entire outbreak. So there's still the things that we're sort of actively taking into account. So I think, as the Chief Minister has repeatedly said, any easing will be very gradual. But obviously all those discussions are on the table at the moment.
Lastly, I just wanted to ask about exposure sites. We've obviously seen lots of exposure sites come online in the coming weeks. Is that providing a risk, still seeing that number, this far into the outbreak?
So that's new exposure sites in recent days? Yeah. Look, yes and no. I mean, I think you'll note that most of those sites are casual or even monitor for symptoms, where we don't actually request or require anyone to have a test. So they're much lower risk. In terms of what, we're not really looking at the overall number of exposure sites, it's the risk profile of those exposure sites, and how many people are not in the community during the infectious period that we're really looking at.
Is the Health Minister available for questions?
Yeah, thank you.
Minister, with relation to people with a disability and lower vaccinations compared to the overall cohort, you've mentioned how rapidly increasing aged care staff got their vaccinations given the mandate. How come we haven't seen the same sort of urgency or exponential increase in vaccinations with the people with a disability and associated staff, given that we've just had a cluster a couple of weeks ago and it's a very vulnerable community?
So I did talk about this a couple of days ago in relation to the updated data on people with disability, but also disability support workers. And in that update, I did advise that we'd seen a 10 percentage point increase in the first dose vaccination for NDIS screened disability support workers from around 58% to 68%. And that was in the space of around a week from one lot of Commonwealth data to the next. So I think that's a really good sign that we are now starting to see that enthusiastic uptake among that cohort of disability support workers. In addition, of course, to support people with disability who may need a particular setting for their vaccination that enables mobility needs to be met or sensory needs to be met. We are, of course, expanding our access and sensory clinic, which is moving to Western Creek from next Monday, and we're expanding that to 5 days a week from 2 days a week. So that will enable us to bring forward appointments for people who already have a booking, and that's been a very welcome service and support for people with disability in the community. But of course, our other vaccination hubs also remain available to people with disability and their families and carers. So we've continued to work with the Commonwealth to increase those numbers. Of course, we want to see them increase. And I think this is a really important point about when we talk about 70% or 80% across the community as a whole, that is made up of a whole lot of different numbers across different groups of people in our community. And of course, we know that that is 0% among children under 12 years of age. But it is also variable among different groups who may have different levels of vulnerability. So that's part of the reason we're very focused on our Access to Equity program, that to ensure that everyone who is going to be vulnerable to the worst impacts of COVID-19 or who might be a transmission risk in relation to coming into close contact with people has access to a vaccination opportunity.
Seeing first dose vaccinations or bookings increase, or kind of just still plateauing for this cohort?
So we have seen, pretty strong take up now. And again, I want to thank those disability community and sector leaders who have been out there making videos. I think ACT Health just recently did a video with Women with Disability ACT with a range of people with disability talking about the importance of getting vaccinated and why they had chosen to get vaccinated to protect themselves, but also as part of that protection for the wider community of people with disability and the whole of the ACT.
If I could just grab the Chief Minister for one more question. Thank you.
There we go. I thought I'd escaped the grilling. But
Thank you for coming back. Just wanted to ask you a quick question on, that in New South Wales this afternoon there'll be a meeting about what possibly easing some lockdown restrictions in parts of New South Wales. I just wanted to know if you've had any direct discussions with the Deputy Premier about what this might mean for the surrounding region, not only because he's the Deputy Premier, but he's also the member for most of the region surrounding Canberra.
No. John and I had a little bit of a chat after the Merimbula incident. He sent me a message saying, "Don't believe everything journalists say." There we go. But no, most of the conversations that we've had with New South Wales have been through me and the Premier, and largely in a National Cabinet setting. Outside of National Cabinet meetings, officials have followed up and officers have followed up. But no, I have no insight other than what I have seen in the media and the stories that are placed, for example, in the Australian newspaper that one day say one thing and then one day say another. So your guess is as good as mine on what New South Wales will do.
Chief Minister, we just heard the Health Minister say that the 80% is made up of lots of different vulnerable cohorts and different cohorts, including the one under the age of 12. Are you happy with the vaccination status of our vulnerable communities, such as homeless, housing commissions and people with a disability and aged care?
I'm not happy with anyone's vaccination status at the moment. We can all do better across every single cohort in the ACT. The one that I'm close